You know, what we haven't seen up until very recently is we haven't seen the same degree of innovation in diagnostics that we've seen in therapeutics. And there are a variety of reasons for that. One of the reasons is that there hasn't necessarily been the business case to justify investments on the part of private investors up until recently in diagnostics, particularly early stage diagnostics. As we move more from a strictly fee-for-service world into a value-based reimbursement world, whether or not a diagnostic test gets separately reimbursed will be less important. What will be important is, does it save lives, and does it do so in a way that increases value, that is, achieving better outcomes for lower cost? So we certainly need better screening mechanisms for breast cancer, and I think that there are innovations out there and people capable of bringing those innovations to fruition that hopefully 5 to 10 years from now will have those advances that then will either supplant mammograms or will augment the specificity of mammograms, so we're not getting, the number of false positive interventions that are so troublesome today.
So I'm going to open it up for questions in just 1 second, so think about your questions. But I want to ask very concisely, if you would say, is our failure to move towards this prevention paradigm more of a payer problem or a science problem? In other words, do we, as you mentioned, do we just not have payment systems and an infrastructure in place to pay for the diagnostics that might make a difference and couple that with a code that insurers are willing to pay for? Or is this more of a science problem?
Well, you know what both of us are going to say, it's both.
Yeah.
But I would even go a step further and to say it's a cultural problem, it's a focus problem. And I think it's much easier to focus on a discrete issue, one gene, one targeted therapy. Yeah. Prevention is really big, but as you argue, Cliff, I mean, right. If we organize ourselves around trying to tackle this problem, I have no doubt that we can. I mean, we have the ingenuity, the know-how, now the technology and big data, all of which can be applied to tackle this problem. But I think the infrastructure and society, the way science works, is not set up to reward people who look at prevention rather than targeted therapy.
No, absolutely.